Alzheimer's disease is a complex disease that begins to damage the brain long before symptoms appear. Alzheimer's disease affects processes that keep neurons healthy, such as communication pathways, metabolism, and repair. The pathophysiology includes the brain. The cortex shrivels up, damaging the thinking, planning, and speech perception and remembering. It is a progressive disease that also involves two neurotransmitters, acetylcholine and glutamate. The hope for the future is that researchers want to catch Alzheimer's disease in its earlier stages to prevent deterioration of the brain, which is irreversible. Currently, there is not any proven or validated biomarkers to diagnose Alzheimer's disease, but researchers are still investigating some promising leads, which include brain imaging, certain proteins found in CSF, the cerebral spinal fluid, blood, and urine tests, as well as genetic risk profile. Experts believe that biomarkers may be a promising path to diagnosing Alzheimer's disease earlier, which could help by being found before the brain has deteriorated beyond repair. A biomarker is defined as something that can be measured to accurately and reliably indicate the presence of disease. So, for example, when a patient has diabetes, they use a test such as fasting blood glucose, which we all know as blood sugar level, that indicates to us the presence of diabetes based on the number given. However, this does not exist for a patient with Alzheimer's yet. Alzheimer's has 4 stages, which, as I said before, it is a progressive disease. So stage 1 is mild, loss of intellectual ability. Stage 2 is known as the moderate phase, with deterioration becoming more evident. Stage 3 is moderate to severe, and stage 4 is a late stage, which can end in death, usually due to a secondary infection or choking. Dementia, a patient may have Alzheimer's and dementia, but just because they have dementia does not necessarily mean they have Alzheimer's. Therefore, assessment of dementia is very important. Safety is the number one biggest care plan for a patient with Alzheimer's and dementia. As they wander, their risk for falls, seizures may also be prevalent, so risk for injury is always present in a patient with Alzheimer's. Impaired verbal communication may also be a problem as well. You want to make sure that the family and the patient have transportation and resources to them that they may need. Implementation, you always want to speak slowly and identify yourself to the patient. And health teaching to the patient and their family is extremely important. You want to educate the family about the resources that may be available to them and give them support, as it can be very challenging taking care of a patient with this type of condition. So in summary, Alzheimer's is deterioration of the brain affecting neurotransmitters. There are some brain scans that can show some deterioration of the brain, but there are not diagnostic tests specifically for the presence of Alzheimer's. In summary, research is ongoing for better outcomes for treatment of patients with Alzheimer's, as there are not any known successful treatments at this current time. The care for patients with this disease is just safety and caring for the manifested symptoms that the patient may be experiencing. The biggest nursing care for a patient with diagnosis is education and for the family and safety of the patient.